So abortion is procedure to end pregnancy. It can be of two types: spontaneous abortion or induced abortion. Spontaneous abortion is also called as miscarriage. So it generally happens due to chromosomal abnormalities in the baby or maternal infection. So in this video we will learn about what is the presentation of the female complaining of abortion, and how we will investigate the different kinds of abortion, and what are the management. Three things we will do. So first is, female will present with amenorrhea, bleeding and pain. Amenorrhea is absence of regular menstruation. She may be present with bleeding and lower abdominal pain. So then the next thing that as a healthcare professional we will ask about the history of expulsion of product of conceptus. So what is product of conceptus? It is the embryo that is present inside the womb. So we will ask from the patient that whether there is a history of expulsion of product of conceptus or not. If there is history of yes, then we will ask one another question, that is we will see os is open or closed. So we will do per speculum examination. So we will see the os is open or closed. If it is open, then it is incomplete abortion. In the incomplete abortion, the product of conceptus is not completely out. Means few part of product of conceptus is out and few remain inside the uterus. In the complete abortion, the os is closed because all of the product of conceptus is out. So in case of complete abortion, we can check by doing USG that the POC is inside or out. Generally in most of the cases it is out. In incomplete abortion, we will do suction and evacuation. Now coming to the other part, if the product of a conception, expulsion of product POC is not there, then we will check for the os. And if the os is open, then it is inevitable abortion. Inevitable means it is most likely to be aborted in near future. If the os is closed, then we will do per vaginal examination, and by per vaginal examination we will check the size of uterus with respect to the period of gestation. If the size of uterus is less than the period of gestation, means the baby or the embryo is already dead inside, so it is called the missed abortion. But if the size of uterus is equal to period of gestation, then it is threatened abortion. In threatened abortion, we will just give the empirical treatment, like we will tell the patient to avoid coitus, to avoid heavy lifting, or we will give some diet tips. In case of missed abortion, there is two kind of treatment. One is symptomatic management and the other is specific management. The specific management is the surgery by suction and evacuation, and for all type of abortion, for all type of missed spontaneous abortion, main is suction and evacuation. Symptomatic management is we will give IV fluid if required, or we will arrange blood for the patient if required. So this was all about spontaneous abortion. In the induced abortion, we also call it as medical termination of pregnancy. So rules of MTP is legal for only 20 weeks of period of gestation. In the case of rape, the MTP can be extended to 24 weeks. But in some special case like gross congenital anomaly of the baby, MTP can be extended for more than 24 weeks also. Second thing is, one registered medical practitioner consent is required for MTP within 20 weeks. But after 20 weeks, if any female wants to have MTP, then two registered medical practitioner consent is required. In special cases of MTP in more than 24 weeks, there is a team consisting of 4 members, and the team will decide that whether the female should go for MTP or not. The team will consist of 4 members. One is gynecologist, pediatrician, radiologist, and one administrative member. Now coming to the medical part of the MTP. So for MTP we can do by medical or surgical methods, and we have divided into two parts in the first trimester. So surgical method is very simple, suction and evacuation. It is allowed till 12 weeks, means first trimester. In case of medical management, we have in first trimester, if the period of gestation is less than 7 weeks, then we will give tab mifepristone and tab misoprostol. So on the day 1, tab mifepristone is given, which is 200 milligram, and on the day 3, tab misoprostol is given, which is 400 microgram. So after giving tab misoprostol, in the next 4 to 6 hours, generally there is a release of POC from the uterus through the vagina. As misoprostol is a prostaglandin E1 analog, it helps in the contraction of the uterine muscles. If the period of gestation is between 7 to 9 weeks, we will give mifepristone 200 and misoprostol is increased to 800 microgram. In the second trimester, the surgical management changes to dilation and evacuation. Okay, And the medical management, we will give 400 microgram misoprostol, and it is given 5 times after each 4 hour per vaginal it is given. So misoprostol could be given orally, vaginally, sublingually, etc. But mifepristone is given orally only. So, but nowadays we use both medical and surgical management. So before surgery, before 4 hours of surgery, we give misoprostol 400 microgram, and after that we use dilation and evacuation technique to remove the product of conceptus from the uterus. This was all about abortion, spontaneous